Thank you very much to my colleague Annie Custer and to Senators Hassan and Shaheen and Governor Sununu as well for being here. The briefing today was thorough as we heard about the state's efforts to respond to this. So we certainly want to really just say that the folks at Health and Human Services have done a wonderful job at making sure that information gets out there to the public in an appropriate fashion. As the state looks at containment and mitigation of this, if this does continue to appear in New Hampshire, we want to make sure that we provide all the federal resources necessary so that can be a complete response that looks to protect public health. So as the public continues to hear about this in the media, it's important that we listen to those voices in the public health community to ensure that we're taking all the steps we can to protect ourselves. One of the places that I've looked as chair of the Oversight Investigation Subcommittee for the Veterans Affairs Committee in the House has been communicating with VA, which is our nation's largest healthcare system, to make sure that VA is well equipped to deal with this. I was on the phone this morning with the director of the Manchester VA. They are well stocked in terms of masks and gowns. They're communicating well with their regional partners out of Boston, and they feel that they're well prepared to follow the action plans that have been in place for a long period of time. So for VA and all of our healthcare facilities around the state, for our hospitals, I know they're all continuing to look for ways to work together to make sure that we can all pull in the same direction as this continues to present itself in New Hampshire. So there is deep concern across our state. We all need to be calm, cool, and collected as we respond to this, to listen to our public health officials and make sure, the bottom line is out of Washington, that we get the resources we need to continue to allow these efforts to go forward. And I know that the delegation is eager to get back there to get the job done this week. So with that, I think we'll turn things over to Dr. Chan for some remarks.